Hi, my name's Dr. Eric Daiter. To give you an idea of some of my background, when I was a younger man, in my late 20s, I was in graduate school at the University of Pennsylvania doing social sciences and some research. And I was in a horrible accident. And the physician team that took care of me and rehabilitated me and brought me back to health changed my life. They helped me in such a way that I decided that it was my mission, or would be my mission, to then go on and try to help others as I had been helped by this crew. And so I went back to school for the sciences. I took all my sciences in college in 1 year, and I applied for medical school, and I was fortunate enough to be accepted at Temple University in Philadelphia, Pennsylvania. I completed my medical school and then went off to residency program in obstetrics and gynecology at Albert Einstein in New York City. And that was a tremendous program because it had tremendous mentors who helped me to identify that the purpose of a physician is to do everything that they can possibly do to bring all of their skills and all of their knowledge and all of their experience to try to help the patients that have entrusted them with their care. And ever since then, I've been trying to do just that. So I finished that program and I did well, and I was fortunate enough to then get enrolled in the Hospital of the University of Pennsylvania's infertility program, which is was at that time, and I think still is, one of the best infertility programs in the country, possibly the world. And at that time, there were 2 past presidents of the American Fertility Society that were actively engaged in clinical activities at Penn in that program, Dr. Luigi Mastriani and Dr. Celso Garcia, whose brilliance and dedication to infertility research and also clinical medicine allowed me to develop that interest as well. And I've been trying ever since then to practice as I had been taught by them, and to provide the best possible kind of care for my patients. I entered clinical practice and private practice about 20 years ago, and ever since then I've kept my eyes wide open, looking for patterns, looking for what worked and what didn't work. And some things didn't work and a lot of things did work. And for certain people, certain things work, and for other people, other things work. But there isn't, in my experience, one treatment that is good for everybody. So in my practice, what I try to do is I try to sit down with you as a new patient and go over your history, go over your own interests, get to know you a little bit better so that I can help you to customize a treatment protocol that you're comfortable with. I don't believe that there's one treatment that is good for everybody. There's a lot of IVF centers in New Jersey where I practice that believe that in vitro fertilization is the best treatment for everybody, but it isn't, in my experience. I try to customize your treatment protocol to what you want and what you desire and what you can afford and what you're comfortable with. So it takes a lot of work, it takes a lot of listening, there's a lot involved with it. And once we go through a series of diagnostic tests, we can develop a treatment plan that works for you, and then you can decide amongst the available treatment options which one you want to engage, which one you want to start up with, and then we can go from there.